I'd like to apologise for more blackpilling stories, but I do believe that this is very much in the public interest, which is the reason why that we do these videos and investigations. This particular video is about a Restore Britain investigation into official NHS England documents that set out the healthcare services provided inside immigration removal centres. Now, these are the places where people with no right to remain in Britain are held while the Home Office tries to remove them. These documents are classified as official, sensitive and official. They are the formal service specifications that NHS England commissions for adult immigration removal centres, and I'm going to take you through the key findings using the official wording wherever possible, and I'll tell you exactly where each quote comes from. So number one, the overall purpose. It says here, quote, "Detained individuals should receive high quality healthcare services. Healthcare services provided to people in IRC should be equivalent to those available to people in the wider community. IRC should be an opportunity to address previously unmet healthcare needs, as well as contributing to addressing health inequalities in the wider community." So the official policy for the NHS is that people that are held for removal of this country must receive the same standard of care as British residents in the community, and that detention itself should be used as a chance to fix unmet health needs. I'm trying not to, say something that could get me into trouble. Anyways, number two, free medication on deportation. This is going to be the part that will shock most people. This is from the primary care annex. A supply of medicines is provided on discharge from the IRC so that those released to the community have a minimum of 28 days of supply or a community prescription. Those removed or deported have up to 3 months of supply, and the supply meets the legal requirements of the receiving country. So when someone is being deported or removed from Britain, the NHS is required to give them up to 3 months of free prescribed medication to take with them back to their homeland. Number three, speed and scale of free services. The documents require 24-hour primary care service, 52 weeks a year, including bank holidays, first night health screening within 2 hours of arrival, full health assessment within 7 days, emergency referrals seen within 2 hours, urgent referrals seen within 24 hours, urgent dental care for pain or trauma within 48 hours, or assessment within 24 hours, full mental health service with urgent referrals seen, substance misuse service that continues treatment even when someone is being removed, and opt-out testing for blood-borne viruses, sexual health screening, TB screening, cancer screening programs, full vaccination programs, smoking cessation, and long-term condition management. That's opt-out, by the way. You can opt out on that if you're about to be deported. All of this is free at the point of use, funded by the British taxpayer. For people the Home Office has decided have no legal right to stay, FYI. But it keeps going. Number four, escorts and hospital care. The specification also requires the provider to manage escorts and bed watches, meaning NHS-funded staff accompany detainees to external hospital appointments and, if needed, stay with them on hospital wards. We're paying for that as well. And number five, it's called the official objectives. The two national objectives written into the contract are Objective 1, to improve the health and well-being of people in IRCs and reduce health inequalities. And Objective 2, to support access to and continuity of care through the IRC estate, post-detention into the community where appropriate and where possible. Look, these are not leaked memos, these are official. Current official NHS England service specifications that every single healthcare provider working in immigration removal centres must follow. And you have to think, ordinary British people facing long waiting lists for dental care, mental health support, GP appointments. The system is required to deliver rapid, comprehensive, community equivalent care, including up to 3 months of free medication to people who are being held specifically so they can be removed from Britain. That is the official position set out in black and white by NHS England in 2024, and it continues. I'm sorry to have to annoy people, whether this riles people up or just plainly upsets people. It is within the public interest for you all to know. And there are people on the left and the establishment, that include the right, that think that this is all false or it's all a myth. Well, it's here in black and white, so you can read that for yourselves.